Emma Soos is the MD of the Women's Health Clinic. Emma, thank you so much for joining us today.
Hi, Emma. Right, can you tell us a little bit about yourself and your company?
I'm Managing Director of a company called the Women's Health Clinic. My background is nursing. I'm a registered nurse. And I set this business up initially to help women that were in similar situations to myself as a result of what had happened after I had a baby. And it involved using a laser to create a treatment. Very, very quickly it snowballed and lots of people were very, very interested, and we've now grown within the last 18 months. We've now got 9 clinics and 17 nurses at the last count.
Interesting. We don't really have lasers on the show very much. Can you tell us a little bit more about the lasers and what they're used for?
Lasers aren't new. They've been around for over 40 years now. And the particular modality that we use is one of the oldest and safest there. And basically the principle behind it is that it causes some damage to tissue. In our case, we're treating ladies' vaginas. It's used in facial aesthetics, it's used in plastic surgery. And the principle behind it is that there is an injury, and the result of that injury healing stimulates new collagen. Now, in terms of what we do with our patients, what that does is that addresses some of the issues that women have relating to childbirth and so on and so forth that can cause a laxity in the vagina, resulting in things like urinary incontinence and sexual dysfunction.
Interesting.
So it's the CO2 laser.
Yes, that's right.
It's very interesting because this is an incredibly sensitive area, obviously, and it's not something that's talked about very much.
Yes.
Do you find that women require information?
Most definitely. We were absolutely blown away by how successful we've been. There are competitors out there that are using similar modalities. What we did that was different is we applied the use of what we know happens with the laser to develop a service whereby it's completely and utterly nurse-led, which nobody's ever done before. So we know as a woman that sometimes if you've got a problem, you can't always get to see a female doctor, and if you do see a doctor, you may only get 10 minutes, and that's only scratching the surface of a lot of the issues that we have. So that's the unique thing that we've done is to apply an existing technology using nursing skills to develop a whole service around that.
So the people coming in to look for this service, they're immediately informed, but also more relaxed in the setting and the way in which you communicate with them, rather than perhaps a GP's appointment surgery. And I'm assuming you can probably spend a little bit more time to explain the details of the service and beyond just the 7-minute consultation you might have.
So all of our appointments are a minimum of 45 minutes.
Oh, wow.
That's great.
At no point do we have any salespeople. You pick up the phone, there's a nurse there. So there's a lot of our patients are coming very well informed, so they already know that this type of treatment exists. A lot of patients are frustrated because they've gone through the normal channels of healthcare and not got anywhere, or they've not been put in front of the right person, or the women's physios, they're few and far between. London might be quite good, but Birmingham may not have access to those services. So some women are coming to us as a result of online searches, some of them at sheer frustration, and some of them, the big question in our own campaign that we're doing at the moment, am I normal? That's one of the biggest questions. We see ladies all the time, we know what's normal, and when you look online and things, you see things and you either get the extremes of when things go wrong or beautiful and absolutely perfect. Most of us don't fit into that. So for us, it's addressing all those other concerns as well.
Yeah, sort of that sanitized body issue or body image issue is, mainstream media does nothing to help sort of portray the diversity, the normal range of diversity out there. So do you work with primary care clinicians as well, or is it an entirely private service that people have to come to you and find you on their own?
At the moment we're a private company. We don't want to see ourselves as a standalone. What we've got within our network, all of our nurses predominantly have got other roles in other positions. So some of our nurses are midwives, some of them are sexual health specialists, some of them, like myself, are urology nurses. So we all come from a diverse background. And in terms of developing our connections with primary care, the main difficulty is the technology to assess exactly what happens to vaginal tissue doesn't exist. We've got MRI and CT scans, so when people are looking at clinical data, we can't actually look at the minute detail, so we actually have to go on what our patients tell us. So things like, I found that going to the bathroom was easier, I found that intercourse was more pleasurable or less uncomfortable. So that's something that we're working quite closely with a lot of other healthcare practitioners, so urologists and gynecologists, to start working out how we can start to really, really see what's going on with patients, and that's quite exciting.
It's kind of a two-pronged issue, really. From the patient's point of view, it can be embarrassing, it can be difficult to talk about these issues, and obviously you're questioning whether you're normal or whether you're just complaining without cause.
Yes.
So that's the issue. And then also for the clinicians as well, in gynecology in general, the pressures on the resources are so great and increasing that often things will be left until it gets to the point where surgical intervention is the option that's given to the client rather than a more non-invasive technique. Whereas I feel that a lot of your users must be interested in the fact that this isn't surgical.
So we can treat, because of the nature of CO2 lasers, we can actually treat people at any stage, so whether they are pre-menopause or perimenopause or pre-op, post-op. So what we're doing is stimulating new collagen growth. The other side of it as well is there's a huge psychological element in that patients need. We went into nursing to look after people, and sometimes when you actually talk to a patient about the symptoms of vaginal atrophy, for example, so the looseness, we can actually work out that it's not what they possibly think it is. It may not be the childbirth, it may be menopause, it may be problems with periods or so, or dietary issue, anything along those lines. So we've got that knowledge to be able to really drill down with those patients as to what's going on with them. One of the examples we've had as a barrier to people getting information, and we've just found recently, we did a Google AdWords campaign, and they blocked the word vagina.
They blocked it?
Yeah, so
yes.
If women are looking for help, then one of the things they want to talk about is their vagina, so you're going to put that in the search engine. So one of the reasons recently we did a survey on about 1,800 of our patients, and it came back to us over and over again, education. We want to know, not just at secondary school about periods and having babies, but at later points of our life, about the menopause, when to be worried about periods. So we've developed quite a big Change.org campaign to try and get, like you say, the primary caregivers to listen to what we're saying, because we are the voice of our patients, and our patients are saying they want help and they can't get it.
Well, you raised the point that quite a lot of the feedback that you get is still considered anecdotal because the science actually hasn't paid attention.
Yeah.
So perhaps now primary care and the people looking into the reasons why you're getting such amazing feedback are now going, well, hang on, what is going on down here? Let's start inspecting from a science-led approach. So do you think that is also going to raise further awareness and provide you perhaps with some additional tools?
Most definitely. I mean, we've been going to quite a lot of the menopause conferences and so on, and everybody knows that laser works. They're not quite sure why. They know the nature of it. It's existed for a long while. So we're partnering with a consultant, a professor in urology, and he's like, I know it works, and I've seen it work, and I just don't know why. And like, well, let's explore that. So that's what we're hoping to do. I mean, one of the key messages we're trying to get out is that women have really taking a real let's suck it up buttercup sort of approach, and we're just as guilty as practitioners for doing that. Oh, it's because you've had 2 babies, it's because you're menopause, and actually we don't get to opt out of these things. We don't get to opt out of periods, we don't get to opt out of menopause, we don't get to opt out of childbirth. There is no other point where you go into a room and come out completely different physically and mentally, holding another human being. And that's quite a big transition, and we leave women, sometimes they leave that labour room and they don't actually address what actually happened in there, either physically or psychologically. And that's, again, one of the key things that we've picked up in terms of women's health is developing. And technology like ours is a small drop in the ocean compared to where we can actually go with this.
I mean, I think it's absolutely fantastic working towards empowerment in this area.
I mean, one thing I don't think I've asked yet is how difficult is the treatment? How long does it take to recover? How long does it take to see the benefits? Are they in and out? Is this like a day service? Just a little bit about that.
So basically what happens is that everything is done online before the clients come. So that's one of the other things that we've done, is we've built tech into it at every point. Some of the questions we ask, we need to have measurable data for research purposes. So questions about things like lubrication, sexual satisfaction, climax can be quite difficult to ask somebody when you've never met them before.
Face to face.
Yeah. So we have that, the patients do that form online, they're prepared with the nurse. They arrive on the day, we go through the form, pick up anything on the consultation, and we have 45 minutes. Some real cans of worms get opened up sometimes. Sometimes you can hear hilarious laughing, other times we can hear tears. The patient, it's their platform. At some point they'll decide they want a treatment. Again, all the forms are online. Take the patient through, and the treatment takes about 10 minutes, 10 to 15 minutes. Yeah. Very similar to a cervical smear test, and the cage is put in. I think we've got a video on our YouTube channel. We put the video, the laser head in, and we fire that. What it does is it creates lots and lots of tiny micro injuries. It's not very uncomfortable for women because there's not many nerve endings in the vaginal area. Once we've finished on the inside, we then treat all around the outside of the entrance to the urine tube, the urethra, around the entrance of the vagina and around the labia, which stimulates new collagen growth and plumping and so on, and improves, for about 8 to 9% of our patients, sexual gratification goes through the roof. So it's a happy side effect. After the procedure, the patients feel on the outside a little bit like they've been out in the sun, a little bit warm. That lasts usually for about 24 hours, anything up to 72 hours, because the first phase of wound healing is inflammation. 4 days post-procedure, they can get back to normal things like sexual intercourse, swimming, and so on and so forth. Most women find that within a day, everything's feeling like it's back to normal.
What about the complications question?
There's no real complication. The worst case scenario is a patient may get a touch of thrush, and that's usually because the pH balance is a little bit out of whack, sometimes as part of the menopausal journey, or because we've altered that tissue there. But the vagina is a self-cleaning organ. This is why the panty liner industry is so buoyant, because we're constantly producing that mucus where the cells are turning over.
Emma, thank you so much for coming and talking to us today.
And if people are watching and they want to find out more, do they go to the Women's Health Clinic?
Womenshealth.clinic is our website.
Womenshealth.clinic. And your services are London-based at the moment?
We have 9 clinics across the UK, so,
wow.
all the way up as far as Manchester, all the way down as low as London, and we've got a couple more in the pipeline as well.
Check out the website, find out more information if you're interested. Thank you, Emma. Now.